strokes are happening to younger people nowadays, and I think it's really important to get the message out there.
We know a 15-year-old boy up the Sunshine Coast in Queensland who had a stroke. You know, he had scarring on his heart. Nobody knew about it, bit broke off and bang.
There was a 7-year-old on there who had a stroke, and I was like, damn, I thought I had it bad.
3 to 13 in every 100,000 children have a stroke every year. There's little evidence, or I guess a lack of published research about the real cause of stroke in children in most cases. So the cause is really relatively unknown, unfortunately. Yeah, it really depends on the cause of the stroke if that is established, but somewhere between 20 to 40% go on to have recurrent strokes.
Well, I had my stroke when I was 11 years old. I was very healthy, fit, perfectly social, you know, top of the class, top of athletics, top of all the sports, and for this just to come out of the blue, just amazing. Took the ambos probably about 10 minutes to get from Blackburn Clinic to the hospital because I kept dying. My heart kept stopping. So the ambulance drivers just put their foot on the gas and just took me straight into the Children's Hospital. As I was getting wheeled in, there was a bloke walking out of the emergency ward. He saw me and he's gone, there's something wrong with this kid. And that was it. And he pretty much picked it straight away, and 16 hours later, and my parents finally got to see me, and I had every life support, every tube known to mankind out of me. And there was also a priest in the room explaining to my parents that I've got probably three, maybe 4 hours to live, and to say goodbye. When I had my stroke, I was going from primary school into high school, but coming from where I was, I just had a target on my back. Every kid, I was the butt of every joke. Because I just had learnt how to count to 10, spell cat, you know, spell dog. You know, I didn't know how to multiply, I didn't know how to subtract, I didn't know anything about any of that because I'd just come out of hospital. I was told I'd never walk again. So I started to walk again because my parents actually said, we'll buy you a boxer dog, a puppy, if you can walk the puppy.
Yeah, I think chatting to the medical specialist to start with, the neurologist or paediatric neurologist, is the first step in really finding out, number one, what the cause of the stroke was, if that's a possibility. If there is unknown causes, then general stroke prevention, so secondary prevention, looking at maintaining a healthy diet, regular exercise, you know, maintaining a healthy lifestyle, taking any medications that are prescribed, attending regular appointments, and really keeping active, I guess, as the child ages, goes into adulthood. There are childhood stroke support groups, and also usually on a yearly basis a retreat for childhood stroke survivors and their families or carers. There's a lot of childhood survivors that find the retreat extremely beneficial, particularly carers as well. They get to go and you know, liaise or communicate with other parents, so I think that's really, really important.
The advice that I would give to any parents that have had a child that's had a stroke, look, it's going to be a roller coaster ride. For the rest of your life, it's going to be a roller coaster ride. Your son or daughter is not the same person that they were. So look, from my perspective, and also from my perspective of working in disability and so forth, never give up on them. You'll be amazed what can happen.